Hi, I'm Dr. Camille Clare, Tenured Professor and Chair of the Department of Obstetrics and Gynecology at Downstate Health Sciences University. Access to maternal health care is becoming more inaccessible for many of our patients. Ongoing financial, staffing, and policy challenges have forced hospitals to close, causing patients to travel longer distances or go without needed care. In Brooklyn, a pregnant Black individual is 8 times more likely to die from a pregnancy-related cause in comparison to a white individual. The period of 12 months after delivery can be critical because some of the deadliest pregnancy complications happen during that time frame. Those living with maternal mental health conditions must have continuous access to care since they already face systemic challenges in accessing the treatment they need. Overall, women and those seeking obstetrical and gynecological services in New York are vulnerable to adverse outcomes due to the availability of reproductive health care services. Policies that improve access to maternity care are Medicaid expansion and extension, the improved integration of midwifery models of care, reimbursement for doula services, improved reimbursement of obstetrical and gynecological care for physicians, including addressing the malpractice burden for physicians, and the increased availability of telehealth services across a range of healthcare specialties. In an effort to address the needs of our patients in Central Brooklyn, the Department of Obstetrics and Gynecology at Downstate and the Arthur Ashe Institute of Urban Health received a grant for Black maternal health research aimed at addressing the growing maternal mortality rate in our geographic area. This project, called We Care About Brooklyn, will attempt to mitigate systemic racism by comprehensively addressing the unmet social determinants of health of our patients, including food insecurity, lack of housing, and daycare. This will allow our patients to continue to get health care throughout their pregnancies and the postpartum period. As we reflect on the significance of Maternal Health Awareness Day, we can all play a role in helping to reverse the course and improve patient outcomes. Let's raise awareness about how access to maternity health care is at risk in our communities and how the lives, health, and safety of our patients depend on national leaders coming together to develop sound policy solutions and implement programs and initiatives to restore and protect access to care everywhere in our country. Thank you.